Hello class, welcome to Chapter 13, Ethical Issues in Long-Term Care. Here we see the learning objectives that I ask you to review now and then later after reading the chapter. In the introduction, we want to talk about the many ethical issues relating to long-term care and the emotional impact on consumers. It is important to understand and recognize the emotional impact on someone needing long-term care. It is a huge lifestyle change. Access to long-term care is the first ethical issue addressed here. This deals with access to care. It is far from universal or equitable, and consumers do not always have a choice of services. The ethics of rationing is an ongoing debate. Should health care services be rationed? Should everyone get all services they desire? And who pays? Transfer of assets, also known as spending down. The Medicaid requirement that consumers must spend other resources before qualifying for Medicaid raises ethical issues. They do not want to lose all they have saved over the years. Medicaid is intended as a safety net for those who have no other assets. Lawyers and estate planners find ways to circumvent the rule. Who is right? Let's look at autonomy. Virtually all other ethical issues in long-term care seem to revolve around the question of how much autonomy a person has in deciding how he or she will live and be treated. Autonomy can be defined simply as self-determination. Long-term care consumers want more choice in their care. How to grant autonomy can still maintain clinical safety is an ongoing issue. Culture change, a national movement based on directed values and practices where the voices of elders and those working with them are considered and respected. Autonomy and beneficence conflict. Autonomy in long-term care may conflict with the more rational concept of beneficence, the responsibility of the provider to act in the best interest of the patients. Other autonomy related conflicts would include meeting the wishes or demands of the consumer within the resources of the provider, balancing the rights or wishes of one consumer with others, and then the conflict between consumer desires and provider values. Now let's take a look at informed consent. This means that the customers have the right to have enough information to make intelligent decisions about the care they receive. It is a legal right. It requires making sure consumers understand their options. End-of-life treatment issues. Many long-term care ethical issues involve end-of-life care and all of the complications that attend it. Competency and decision-making capacity. If consumers cannot make their own decisions, someone else must do so for them. Protecting the interest of the consumer. Defining competency is a subjective process at best, and all involved need to protect the interest of consumers who cannot protect themselves. Advance directives, the general term for a variety of documents designed to enable competent adults to make healthcare decision-making plans in advance of possible future incapacity, including living wills, documents that spell out treatments that one wants or does not want in case of future inability to make decisions, or the durable power of attorney. This designates someone to make such future decisions on one's behalf. The Patient Self-Determination Act requires providers to make consumers aware of their right to create advance directives and have them honored. The ethics committees are in-house committees that assist in ensuring the life and death decisions are made properly and in accordance with the wishes of the resident. Feudal care is having to provide life-extending care regardless of the previously stated wishes of the resident when there is no hope of recovery or improvement in the patient's condition. Autonomy, how far to go? This promises to be an ongoing debate with no easy answers. Everyday life issues. Although end of life issues are of critical importance, everyday life issues are much more on the minds of long term care consumers, including privacy, which is a critical component of a feeling of self worth and independence, but not always easy to provide. Shared space. Residents in an institutional setting must sacrifice some of their privacy in sharing space with others. Confidentiality is respecting privacy, and it also means respecting confidentiality, and all consumers deserve it to the degree possible in a care situation. Food. Different people have different tastes and preferences in the type of food they eat. Sometimes this is based on ethnic or religious backgrounds, and complying with all of their wishes in an institutional setting can be very difficult. Activities. Group and individual activities are important for the physical and mental health of consumers and institutions and can reinforce individualism if planned carefully. Restraints. Physical and chemical restraints may be necessary to protect the consumer's safety and well being. They must not be used for the convenience of staff or to control difficult residents. How and how often they may be used are regulated. Abuse. Any form of abuse of long term care residents or clients is unethical and illegal. Abuse may be, as covered in our textbook. We have physical, which is striking or otherwise harming the consumer, not providing needed medication or treatment. Sexual abuse, taking sexual advantage of a vulnerable resident. Emotional can range from the extremes of yelling and name calling to subtle intimidation. Fiduciary, failure to demonstrate appropriate stewardship of the finances of consumers. Other settings, let's take a look at that. The level of dependence of nursing facility residents makes them more vulnerable, but the same ethical issues apply to other settings. Management ethics focus on ethical issues concerning the management of the provider facilities and agencies and may not affect consumers as directly but can have the same long term impact. Ethics management programs. These programs spell out an organization's values. They set guidelines for behavior, train employees, and provide guidance in difficult situations. They usually include the Code of Ethics, which is a description of the organization's values and the ethical rules by which it operates. The codes of conduct, the code of ethics by identifying behaviors that are acceptable, and policies and procedures. The code of ethics by identifying behaviors, again, that are acceptable. Let's take a look now at the summary for this chapter. Review the summary and read the chapter in its entirety, and then review the learning objectives again. And I thank you.